Cytogenetics Part 2, Module 1, Lecture 6. The objectives of this lecture is to recognize structural chromosomal abnormalities, including deletions, insertions, and translocations, and to understand the difference between a reciprocal and Robertsonian translocation. Structural chromosomal abnormalities include deletions, ring chromosomes, isochromosomes, and inversions. A terminal deletion is when there's a piece missing at the end. Interstitial is in the middle. A ring chromosome is when there's a deletion on both sides and the chromosome reanneals into a circular form. Isochromosome is when one of the arms duplicates, losing the other. This is seen primarily in cancer. Robertsonian translocation, a translocation between two acrocentric chromosomes, and insertion of one chromosome material to another. So here we have terminal deletion is when it's lost at the end of the chromosome. Interstitial in the middle. Interstitial we used to think is very rare, but now that we're using new modalities, which we'll get into the future, microarray, we realize it's probably far more common than we realize. So here we have a terminal deletion on the short arm of chromosome 5. You can see where the arrow is. It's always helpful that there's a large piece of material missing. If we can see this through cytogenetic analysis, there's a lot missing. A marker chromosome, which often we use in cancer, like we have this little extra piece and we're not sure what it is. An inversion, here it should be red, blue, yellow, red, but the red and the blue flip, so it's cut on both sides and flip in the middle. Usually this doesn't cause a problem for the individual unless there's a gene here where it's cut, but it can cause problems during meiosis when they have to kind of twist in a weird way in order for crossing over, and can result in unusual fragments. So if a parent is a carrier of an inversion, it can increase the risk of having unbalanced offspring. Translocation can occur between any two chromosomes. Here is chromosome 3 and 21. This large piece of 3 ends up at the end of 21, and this little small piece of 21 ends up at the bottom of 3. The number of the chromosome is based on the centromere and not how much material. So in fact, there's probably more chromosome 3 material on this chromosome. And again, Robertsonian are between 13, 14, 15, 21, and 22. And these nuclear organizing regions are very repetitive and seem to, help these chromosomes to attach more to each other. Here we have an unbalanced individual. We have 46 chromosomes, but when we're going through them, this looks unusual. We're not sure where this big piece is coming from, but it's extra material. And so we look through all the rest of the chromosomes. So what we do is we go to the parents. And here is the father. And we see the same, and the father's normal, but we see the same big piece here. But when we keep going on chromosome 15, it looks too short. So what's actually happened is this top band, a 7, is down here, and this large piece here is over here. And so that is a balanced translocation. About 1 to 2% of the population carries a balanced translocation, and you don't know it unless you have a child with a problem or multiple pregnancy losses. So recommendation for getting chromosome analysis is an individual that has clinical features consistent with a specific syndrome. And as I said earlier, a syndrome is just a bunch of symptoms put together. So if we're worried that the baby has Down syndrome, we should do chromosomes. A mother and father who've had 3 or more pregnancy losses. And again, we have to do both parents. Or early pregnancy loss if there's a lot of early pregnancy losses. So a woman had 5 early pregnancy losses. She has a 3-year-old son who is developing normally. The following is recommended: blood chromosomes on a healthy child, blood chromosomes on the mother, chromosomes on the father, and the correct answer is on both parents.